Alright. Now, how are doulas different from midwives? Doulas are non-medical birth professionals. They join at early labor and they stay throughout the labor. Medical birth professionals such as midwives. Midwives and OBs are different. Midwives can take most of the part of OB unless it is high risk. But she is able to manage high risk. She is able to manage mothers who are 80 to 90% low risk. Okay, and they are trained differently. They have different books. They have different materials. And they are focused primarily on the medical tasks and documentation. Even if you have a midwife who follows the midwifery model of maternity care, you can't expect the whole from her because she is again focused on how the baby is coming, when the baby is coming, when should I catch the baby, how much you are progressing. So you need to have a doula as well. This is what fills the gap, was the gentleman's question. Doula does not attend medically to the birth of the baby. Midwife attends and helps the mother medically with the birth of the baby. Doula advocates for the birth plan. Midwife implements it. Doula does not take medical decisions or suggest or give medical advice or prescribe medical treatments or even influence the decisions of the mother. If you are taking a decision out of fear of me, then I'm a very wrong childbirth educator or a doula, okay? My style shouldn't affect yours. If you want to go for epidural, as a doula, I'm supposed to respect that. As a childbirth educator, I can give you the risks of epidural. I can promote natural birth, but I should not influence your decision. Objective is provide labor and birth support. It is objective here is to deliver the baby. Alright, these are the complementary roles. Both are professionals working together to make sure you and your family are supported. One is non-medical, one is medical. Alright, now if you have a doula midwife team, you'll have not only the goal but also the route to it balanced. Why? Because if you have a midwife, a doula and OB-GYN on the same, speaking the same language as you want at the same page of the birth plan, then you are most likely to reap the benefits. Now coming to natural birth, what do you understand from natural birth? Unassisted birth? No. I'm not telling you to give birth at home, okay, or under a tree, okay. I'm telling you to give birth by being informed. When we talk about natural birth, there are many organizations that, that attract the customers under the guise of natural birth, but when you go there, it's a complete different process. Now, when you talk about natural birth, some of the mothers, they mistake it for unassisted home births. What is a balanced natural birth theory? A balanced natural birth theory is that the mother is supported, educated, encouraged, informed, and be there left to give birth and intervene unless there is absolutely necessity. Which means you shouldn't be disturbed unless you have a genuine medical complication. You know what is the root word for obstetrician? Obstetrician comes from the word obstare, and it means to observe. How ironic. You can research this. So obstetrician comes from the word obstare. So obstetricians and gynecologists were essentially supposed to be doing this. Dr. Francois, okay, was the one who started the procedure of the women lying on the back, because his sister had a very long labor and then she passed away. So to know what was going wrong, he made the mothers lie on their back because it was easier for him to view. So with that, the medical model of maternity care emerged. Okay? So it is more authoritarian. Why? Because for them, it is easy for them to intervene. His intention was different. His intention was to save the mothers. But now it's something else. Right? Now, I am from a certified AMANI Birth organization. I'll talk a bit about it, maybe just 5 minutes, so that you can understand another things which I'm going to bring in. AMANI Birth is not a method. Methods fail you. There are so many organizations like Hypnobirthing, Lamas, Bradley around the world. Fernandez has most of the Lamas certified educators and doulas. But AMANI Birth is a philosophy. A philosophy will not fail you. A method will. If you are going to hypnobirthing and if you go into hypnosis, they train you to go into hypnosis. Sometimes it works. But sometimes if you're not able to achieve that state, it will fail you. And you will feel bad even about investing in it. AMANI Birth is a philosophy that you have a trust in Allah's design, that a woman's body is capable of giving birth. Okay? I'm not saying that is your only task. I'm saying you should trust in Allah. You should trust in your body. Alright? It is the world's only one and first Islamically based childbirth education and doula certification program. I'm a certified childbirth educator and doula from AMANI Birth. At the same time, I can take classes and attend labors. Okay? And it is designed to prepare professionals in the field of natural birth. Our founder is Aisha Al-Hajrah. She is American convert to a Saudi husband. And it is USA-based organization. We have around 1,000 plus trainees around the world doing a lot of things. My intention is to bring AMANI Birth to India, bring Aisha here. And because she's American, obviously she can do a lot of things. But at the same time, my intention is that we have local community people interested in this. It's going to be hard, long. It took a lot of time and investment for me to be here where I am. But once you get known, it's a big full-fledged career and you can do it from your home as well, according to your convenience, no matter how many kids you have. Alright? Our primary goal is to teach trust in Allah first and then foremost and worship that birth is a form of worship. We do not provide medical advice. We do not say, have a home birth. Alright? All we do is, we want you to understand that it is part of what Allah subhanahu wa ta'ala has created. So instead of swearing, crying, complaining, you are gonna do zikr and listen to the Quran and have a positive mindset. Okay? These are our 20 principles, that Allah is in control of all things. Birth is a natural life event. It comes from midwife. Basically, it's based on midwifery model of maternity care. We believe that birth is inherently safe. And there are safety nets. For example, as I said, how your body, pelvis, it loosens. You may feel it as a pain or backache or cramps. But the reason why it loosens is because it has to give way for the baby to come out. Similarly, 50% of your blood volume increases during pregnancy. So you may have nosebleeds or other things. But the reason why it is increased is because that blood comes out in your nifas. Another thing is, you have constipation and digestion. But when you look at the reason and positive outlook of it, the reason is because the nutrients have to get absorbed in the blood for the body. So that is why your digestion is slow. That is why you're constipated. That is why you have hemorrhoids or blah, blah, blah. Okay? So we help you give this information that how there are so many safety nets Allah subhanahu wa ta'ala has created you and how it is proven scientifically and how it is evidence-based. The mother's role is maximizing the birth. Now when we know about these safety nets, we work with it. We don't go against it. We don't complain, we have a headache, and then I'm a patient, I'm going to a doctor. We know we have a headache for this reason, so we have to do these things and work hard for this thing. Okay? You will learn about physiology of pregnancy, physical preparation, why nutrition is important, and how to manage your labor pain naturally, importance of avoiding drugs, and that parental responsibility starts in pregnancy. Okay? The moment the mother conceives is when you are responsible and accountable. You don't have to wait for 9 months. 9 months are for you the time period given by Allah subhanahu wa ta'ala to prepare for it. Right? It's like how your husband prepares for a football or a marathon. He needs stamina, energy. If he lies down and if he neglects his health and his body, so do you expect him to win that match? No, right? So these 9 months for you are there to prepare your body through exercise, nutrition, and good diet so that you can have a good experience and you're more in tune with your body. The more you know yourself better, the more easier it will be. Okay? Self-advocacy, right and responsibility. Nobody is going to be there for you except for yourself. Unless you are, lazy about it, nothing can be done. If you are active, you want to know, you want to bring the change, you want to have a good experience, you need to work hard. Everything comes with perseverance, patience, and hard work. Okay? Birth experience matters for a lifetime. Yes. When I had my first baby, C-section baby, it was a very traumatic experience. Why? Because birth is an emotionally vulnerable moment, and any woman who has any experience takes that as a projection of her self-worth. Because I had a negative experience, I thought I was this. Then I had a VBAC, and now I'm a different woman. My husband says, I'm a different woman. I like this woman in you more than others. Why? Because this birthing experience was better than the first one. It was empowering. Birth empowers. You know why? Birth is an event which includes transfer of control. Why? And when you are in the most emotionally vulnerable state, and if you are given that control, you will be empowered for the rest of your life. You'll be a much more confident woman. The woman I am after my second baby, I doubt I would have been after my first baby. Because with my first baby, I had Caesarean, I had problem with breastfeeding, I was mistreated, I had postpartum depression, I hated my baby. My first baby is very different from my second baby. Second baby, I had VBAC with intact perineum. It was a very long labor, but very good birth. We had taken classes. And I felt empowered. It was a completely natural birth. And the woman I am after that is a very different woman. So, birth decides your personality. Okay? Because your subconscious takes that experience as your self-worth. Okay? It's true. Now, this is a website. So, if any one of you are interested to become a teacher or a doula, you can go and log in. And if we have more number of participants, I can bring Aisha here. Aisha is our founder. Or else, I can even take classes, or you can book me, for the this education and doula support. But the problem is, I come here only for vacations. So it's like coming and then taking a couple and then going away. So I hope if someone is interested to take this up and be a coordinator, then we can bring AMANI Birth to India. So AMANI stands for Assisting Mothers for Active, Natural and Instinctive Birth. Our founder has also written a book called AMANI Birth Book. Those who have enrolled in the classes, they get their student workbooks. This book will give you an Islamic perspective and outlook to how you should be, how the women should be, Muslim women should be, okay? The Muslim women, the companions, they used to go to war, and the women were very capable of producing children. Now 1 or 2 kids, you are gone. Why? Because you are not getting that things which you are supposed to have. You are not getting that support. You are not getting that diet. We are supposed to be different, not the way we are now. Okay? Now, what do we learn from the birth of Maryam and how? One is, now, when you see the verse in the Quran, Suratul Maryam, and the pains of childbirth drove her to the trunk of a date palm. First of all, Allah subhanahu wa ta'ala validates that it was a pain. Not like hypnobirthing does. That no, there is no pain, you call it a surge and blah blah blah. So you have to accept the pain. It is part of the process. Without that, you cannot achieve anything. Second, would that I had died before this and had been forgotten and out of sight. There were a lot of reasons why Maryam alayhi salam felt that way. But this also shows how she was desperate and weak and emotionally vulnerable. Okay? And then cried unto her from below her, saying, Grieve not, your Lord has provided a water stream under you. There are 2 things. You see the support, and then you see water. Before, ACOG released their new guidelines that laboring mothers could eat and drink, the mothers were banned from having anything during labor due to the fear of them taking them for the surgery. Recent evidence-based studies suggest that laboring mothers should eat and drink, and dates are known to have oxytocin, which helps the labor to progress. Jordan date study. You can Google it on internet. It shows that if you have 6 to 7 days from 37 weeks every morning, you are most likely to have a quicker and shorter labor. Subhanallah. I'm talking about the scientific research. And this we learn from our religion. Okay? So the recent guidelines are you can eat and drink during labor. Any hospital that bans you from doing so will give you the message that they are preparing you either for a cesarean or they are stupid and they don't know what the recent guidelines are. And shake the trunk of date palm towards you. So should you be lying on your back? No, right? You should be working hard. You should be moving. You should be moving. And when you push, you have the urge to catch on something. From this verse, we learned that Maryam alayhi salam, the revelation was to take the help of the date palm. If you go to normal birth medical organizations or hospitals that promote normal birth or midwifery model of care, you have separate beds where you can catch hold of the bar, not lying on the back. So eat and drink and be glad. This is my most favorite verse when it comes to this subject. It also deals with a lot of issues like postpartum depression and all. Allah subhanahu wa ta'ala here comforts you to be happy and content. Okay? If we took this outlook and this mindset, the life is going to be different and be changed. Now what do we learn? Both of them had natural births only by the help of Allah subhanahu wa ta'ala. In today's standards, we classify it as unassisted home birth, but we don't recommend that. We don't recommend that because most of us don't have the knowledge and skill to. And because of the many prominent medical complications, we need medical care. Medical care when it is necessary, not unnecessary. Mothers and babies have the instincts to birth. Doesn't imply that you birth under a date palm, but guard your health with good nutrition and activity. Most importantly, work hard to prepare and birth. Okay, don't just sit and think I'm a patient and I'm bedridden. VBAC, vaginal birth after cesarean. VBAC stands for vaginal birth after cesarean. Things you need to know. There are two risks. The doctors will talk about risks. Now, what are those risks? Are those risks usually the medical issues or are they the legal issues? When we talk about risks, there are two risks for VBAC, for those who are trying for normal delivery after cesarean. Number one is the risk of uterine rupture, which is only 1% by the way, which is as rare as you would die with an accident or fall from the stairs. Okay? And the other risk is the failed attempt of VBAC due to any medical complication. The third risk is the risk of being sued. So when your doctor is telling no, you cannot have, you have to try to analyze which risk is she talking about. VBAC is a whole completely different subject, but I'll just touch the basics. Okay? So that we don't run out of time. Now when you want to try for VBAC, you have to learn and understand few things, like what are the benefits and risks for VBAC? What are the benefits and risks for cesarean? Did you know that the risks for cesarean, they supersede the risks for VBAC? But the doctors, they emphasize on risk of VBAC and not for cesarean. Why do you think so? Fear of litigation, money, they can have more money, the cesarean. Any other reasons? How do you feel about planning a VBAC given what you learned about the risks for babies? Make a list of questions or concerns you would like to discuss with your care provider. So when you are attempting a VBAC as a couple, you need to keep in mind these things. If you feel that you are not fully supported, then you can definitely change your care provider. Nobody can stop you from doing that. Now, few of the risks are bleeding, blood transfusion, or damage to the mother's bladder or other organs, infections or severe caused by blood clots, risk to baby. Okay, the baby may be deprived of oxygen. These are the risks for attempting a VBAC or having a uterine rupture. But in a very small percentage of ruptures, babies do not survive. About 2 out of 10,000 women laboring for a VBAC, the risk is this much less. The US National Institute of Health has stated that the risk of laboring for a VBAC are the same as for any other women giving birth for the first time. So women giving birth for the first time also may have a uterine rupture. Okay? Type of uterine rupture. Do you see this picture? You have two types. Okay? Uterine incisions assured in single layer or double layer. When you consider VBAC, you need to understand that and read about your previous medical records. Your uterus should be sutured in 2 layers. If it is single layer suturing, then it means you have higher chances of uterine rupture. So you may consider that. But the uterine rupture risk is less than 1%. A true uterine rupture is a tear through the entire thickness of the uterine wall. This is the uterus and this is a true uterine rupture. It may be partial or complete separation. This is a potentially life-threatening condition for mother and baby. But if you have uterine rupture, you immediately need to have a surgery. Okay? This is like silent rupture, but it's not a complete. It's just in a single layer. So when you attempt VBAC, you need to analyze the risks and benefits of both VBAC and both Caesarean by, concentrating on your personal history and your doctor, and obviously the doctor and hospital you go to determine your outcome. How do you identify rupture? VBAC moms can take a picture of this. The signs are vaginal bleeding, uterine scar or pain. You should not have any pain in your previous scar during your pregnancy, labor or birth. Okay? If you are having, then something is wrong. Continuous contractions with no rest is a sign that you are having a uterine rupture during labor. Blood in the urine, abnormal CTG trace, pain felt while under epidural. Now, when you talk about VBAC, you need to understand what uterine rupture is. You need to also know how fast are your care providers. For example, the risk of maternal death between rupture and hospital is, the gap should be 15 minutes. If you are having a rupture, you should be 15 minutes within the hospital. If you know they are already turtles and very slow, so you should choose a medical organization which is pretty fast in taking you to emergency, or choose a location which is near to the hospital. Okay? Wherein you could reach within 15 minutes, so they can take another 15 minutes to prepare the mother for the Caesarean. Dehiscence or window. The scar stretches thin enough to cause a dehiscence or window. This is also known as silent or incomplete. We already saw in the picture. Now, this dehiscence also occur in 1 to 2% of low transfer scars. Low transfer is nothing but the scar which is low. They cause no symptoms and are not correlated with any increase of rupture. So, dehiscence, only the silent or the window, is not so much, risky. No scar ruptures. So, you have to keep these things in mind. Now, risks associated with Caesarean. The risk of placenta accreta, where placenta attaches to the abdominal wall. It is a very big risk. If the doctor sees that the placenta is going inside the membranes of the abdominal wall, inside the lines, then they may have to remove your uterus. Why? Because the placenta will not be able to come out your abdominal lining, and you will bleed, and postpartum hemorrhage, excessive bleeding leads to maternal death. Okay? So what are the risks associated with Caesarean? If you have more Caesareans, the risk of placenta accreta, which means placenta attaching to the abdominal wall, increase. Then hysterectomy. The risk of removing the uterus increase. The risk of maternal death include blood clots, infection. The risk of psychological repercussions. Breastfeeding may be affected. Long-term and short-term complications. Risk of fetal death or brain damage, which are iatrogenic, which means induced by the medical care providers. Risk of breathing problems for the baby and higher NICU admissions. Reasons for refusal of VBAC. Why would you do that? Why would the care provider refuse you? Alright, so these are the few reasons why a doctor may refuse VBAC. It may be that you have a genuine complication and you cannot go for a VBAC and C-section is necessary. Okay? Second is the hospital policy. Some of the hospitals, they have a policy for no VBACs because of fear of litigation. Okay? Another reason is emphasis on risk of VBAC than Caesareans because the doctors themselves don't know. Alright? Then, trivialization of Caesareans or convenience factor. If the doctor is going on a vacation and if she sees that, she'll lose you out, she may schedule. Now, what are your possible reasons for the first cesarean may be failure to progress or fetal heart rate problems for breech baby. Breech baby is nothing but baby leg down, big baby, or cord around the neck, which is called as nuchal cord, or placental problems. Now, you need to analyze that the things that happened to you with the first pregnancy may not happen again. So based on your personal history and your personal pregnancy experience, you'll have to have a session with your VBAC coach or a childbirth educator who would help you understand what actually happened and help you to go on for a VBAC journey. Okay? Psychological and emotional aftermath, you need to consider this. Consider the impacts of emotional impact or having a VBAC or not. What would you expect? Sometimes, even for the first birth, the mothers are prepared for normal and it leads to cesarean and they are traumatized. Everyone is unhappy. So it is very important for you to be prepared for everything, even after investing in and working hard. Why? Because there are things which are not in our control. There are reasons where cesarean is a savior. But at the same time, when those things happen, then cesarean was your savior. But if things were done to you purposefully or by manipulating you, then that was an unnecessary cesarean. Right? Create a positive mindset and have a right support. It's possible to heal and necessary to mourn your loss of the ideal experience. Try to understand what happened, express and communicate. Forgive yourself and accept that you did what you could, both for the mothers and the fathers. Okay? It's very important to heal. If you don't heal, you will bring in the same baggage to your next pregnancy. I had a client, doula client. She loved her husband a lot. As much as she loved her husband, she feared of failing him. Which means they didn't have a healthy, safe space to feel secure. Secure in what? In expressing raw emotions. They loved each other so much that they didn't want to fail each other down. First labor, 8 centimeter, progress was nicely, then she got stuck somewhere and then she was scheduled for cesarean. Second labor, again 8 centimeter, she was stuck for 3 to 4 hours. As a doula, what is my job? The husband is there, she is there, they are Canadian citizens, very good, educated. She did not heal from her first experience. Because to her, failed normal birth was failing her husband, because in her mind, having a cesarean was questioning her ability as a woman to give birth. And with that, she in her mind felt that she was putting her husband down. So what I did, I let her cry and I let her to took her time. It was 1 hour, 2 hours. She was crying. She was talking about her husband all the time. And I went and I told her husband that, there's something wrong. You both share a very good bond. But she is afraid of failing you. So what is making her feel that she will fail you? Maybe you would have to correct that. So she was happy. Her labor progress was fast. But then she was tired, and then it was a couple's decision that they would go for a cesarean. Then she had to, in her perspective, it was a positive birthing experience, even if it was a cesarean. But her first cesarean was traumatizing. Now, help me understand why both were cesareans, but why this one was good. What is the point that I'm trying to make? The point that I'm trying to make is that it is very important for the couple to go through together and review and understand that they both have to heal. Fears like this, small things like this will alter the process. Another example. There was a woman who wanted an elderly doula because she had lost her mother. That's it. That is all the doula knew. Everybody knew. Everything was normal, labor was progressing good. Suddenly, her labor got stuck. Okay? And it went on for 3 or 4 hours, 4 centimeters, and she's not progressing. Everything is fine, but there are no contractions and she's not dilating. So the doula, she came and she's like, what is it that is troubling me? She said, I lost my mother when she gave birth to me. That is why she wanted a doula who was an elderly looking figure like her mom. This was something which she never healed from. And it was something which was stopping her to move forward. Right? And she thought that she was the reason that her mother passed away. And she would do the same to her child. She said, I didn't want to give birth now because I want to kill my child. Okay? So it took a process of debriefing and helping the mother dissociate from the trauma and heal and etc., etc. And then the labor progressed quickly, 5 hours, 8 centimeter, 10 centimeter, and she given birth. Normal birth. So these examples I'm giving you is for both the fathers and mothers to understand that it is very important that you as a couple heal and do your emotional homework. Women who have had experienced abuse in any part of their life, whether it was childhood or any sort of physical abuse, from their fathers or, even from any woman or men, they will have issues. Why? Because birth is an intimate act. Whenever it comes to intimacy, you have the fear of getting exposed and it will hinder the process. Okay? Trust yourself. Take your time. Know that you will have the support you need. Know that you are capable. Know that your baby will move down easily. You can do it. It's your decision. And listen to positive, successful VBAC experiences. There are two types of people. Even when you befriend, one side of people are very positive. They'll lift you up and they will give you forward to your wings. Another group of people are negative. All they do is emotional dumping. Aaj ye hua, aaj ye hua, aaj ye hua. And when you go to them and when you come back, you get nothing. You are absolutely emotionally drained. And same toxic behavior, you pass it on to your family, both the men and women. So you need to understand whom you are choosing to be around with. Birth plans. Birth plans are nothing but an idea of how you visualize your birth as a couple and what choices you would want to make. Now, there are many kinds of birth plans. These are visuals and this is Caesarean birth plan. You also have forms. So, whenever you want to go for a birth, I would recommend that you do your homework and try to understand what happens in the hospital, what is the hospital policy, and what do you want. So, you write it down. I want this. The hospital allows this, fine, I want this. I want this even if it doesn't allow. And then you prioritize your options. Which is your priority? Do you want your husband to be inside and you are okay with routine episiotomy? I'm talking practically, okay? Sometimes some hospitals, they allow the husbands, but they do routine episiotomy. So are you okay with episiotomy, but you want your husband? Okay? So this is how you prioritize and be practical. The birth plan will give you the best of what you visualized. It will never give you a complete one. If you expect a complete one and if you expect whatever you thought would happen, you will be traumatized no matter how good it went. Okay? So always be prepared for everything. Do your hard work. Now this is Fernandez Foundation. This was my client long back. My first client is a colleague now. She also got certified. This is the midwifery team over there. We have Indian Dr. Evita. They're doing a lot of good work. You can see the father, he's cutting the cord here. They had written in their birth plan, delayed cord clamping. And then the father takes the baby. And then this is how we visualize a positive birthing experience. Not like a doctor taking away. My experience in Almana Khobar, this is our team. Okay, I'm serving there in childbirth education, VBAC coaching, and I take prenatal fitness sessions. And I'm for labor and birth support. How do we do? First, the mother consults and we have documentation with the doctor. And then the doctor refers to our clinic. Then we offer free introductory sessions, an introduction to AMANI Birth and our philosophy. Till date, in the hospital, we have done 800 plus. Then the interested mothers, they sign up for the paid classes or for coaching along with their husbands. And then we discuss the birth plan. So me as a non-medical support person, the doctor and the mother, all three of them are on the same page. The mother writes down the birth plan. I discuss with her. I tell her this is a hospital policy. They may allow you this. They may not allow you this. She will say, I will go and discuss with the doctor. The doctor gives approval for the final birth plan. And she has the experience exactly that she had expected of. Then step 4, the doctor writes down her choices on her file. Then now, coming to the residential doctors, it is another group, another team. You don't have one doctor with you all the time during labor, right? You have on-duty or residential doctors. What I personally do wherever I go, I create a team of residential doctors who know the work I'm doing. So in our hospital, we have 2 to 3 residential doctors who don't cut routinely. So we have so many mothers who have intact perineum and no stitches through those doctors because they are on board with us. So now you have to, since we don't have anything like this here, except for Fernandez, if it falls out of your budget, so your homework would be to try to know what are the on-duty doctors and what are their philosophies. So that it doesn't happen that the consultation gives you a green signal and then you end up having traumatized in the labor room with a duty doctor. Okay? Now, so the mother has her choices respected and is given the best of her birth plan. Alright? So we offer 4 prenatal fitness sessions, 6 childbirth education sessions. All of these are paid sessions. One-on-one VBAC coaching, and these sessions cover physiology of pregnancy, nutrition, exercise, laboring positions, breastfeeding, doula prenatal, hospital tour. So far, we have done 40 plus paid sessions since March 2019. From December 2018 till March 2019, 6 months I've volunteered. Why? Because I needed them to understand that there is a difference in the result. So they said, we don't know what you're talking about. It's going over head. Show us. So I said, fine. I'll be there for free. Now for this work, you need your husband's support. And I was like, there's no money, there's nothing. And my husband's like, okay, fine, let's try, for the ummah, because most of us are not aware. 6 months, every week, he used to go and I used to be like, I'm not getting any money. There's nobody in the hospital listening to me. What am I going to do? After those 6 months, we have the results. We have decreased rates in episiotomy, decreased rates in Caesarean, demand for our clinic, and it was like pretty awesome. I didn't expect that it would be so huge. The result would be so huge. And then the hospital understood. Hey, she was blabbering something. She was actually serious. Let's talk to her and listen to her. And now I attend their board meetings every Monday. So we have board meetings where the doctors know I am there and I'm working, blah, blah, blah. And if there is up and down, they discuss the case. So we provide continuous emotional, physical, informational support, complete non-clinical, non-medical, physical labor and birth support, optimal fetal positioning techniques as a doula, in-house doulas, and we assist with different laboring and birthing positions, deep breathing and relaxation, and assist with natural pain management techniques. Our accomplishments are now we are being recognized as a pioneer for providing in-house childbirth education and doula services in the eastern province in Saudi Arabia. We are in demand for natural childbirth. There are increasing influx of mothers, reduced rates of episiotomies, positive birth experiences, and recently the Ministry of Health in Saudi Arabia, they released the initiative guidelines for mother-baby friendly care to the hospitals. So in Saudi Arabia also, the mothers have the right to refuse episiotomy, to have a doula, to have a husband in her labor room. It's like a big change. So my dream is that every hospital has in-house AMANI Birth childbirth educators and doulas, especially our community. And the impact of doula midwife team, you can see the difference. The mothers always said they felt supported, bonded, guided, complete, motivated, empowered, strong. They completed the team. So imagine the next generation from this kind of women. So the conclusion, it's your body, your baby, your birth, you have rights. The presence of a father is very important, proven, And he plays a very crucial role, which is invisible, but it is very important. At the end of the labor, he's going to be there to decide everything for you. There's a difference between normal and natural birth. Activity, fitness, nutrition, all of this is important. And get informed about updated guidelines and go for evidence-based birth. The last thing is you can definitely VBAC if you are low risk.